Good afternoon and welcome to Facebook Live from CGH Medical Center. This is Dr. Bill Bird. I'm the Chief Medical Officer here at CGH Medical Center. Thanks for taking the time to join me. Today you're stuck with just me, and I don't think we're going to take a whole lot of time because things are going well, and that's always a good thing. But I do have some things I wanted to share about the current pandemic situation. And then I'll give you some updates of what we're planning for upcoming weeks here on the Facebook Live show. So let me start by our usual visual that we'll show you. Okay, so it's just number of cases, and it's all looking good. And I, granted, there's 386 cases, but if I remember right, gosh, we were really high in terms of number of cases. So that's all looking good. The number of people that are hospitalized here at the hospital are really trending well also, which is very encouraging. Thanks, Matt. And I wanted just to share, here's just some other downward trend kind of things that we're seeing here in the county and in the state and in the country. So all really encouraging stuff by and large. So Illinois Hospital Association, what I get every day about hospitalizations, yesterday the state was down to 1,232 patients hospitalized with COVID, which compares to, I think it was 43 or 4,400 during the peak of this most recent surge. So we're down, a lot from where we're at, which is really good. And the state positivity rate is now down to 2.6%, which is also really encouraging. So as you all know, masking February 28th, indoor public places in Illinois is no longer required per the governor. Just want to re-clarify that does not include healthcare. And I think from my perspective, that makes sense in that healthcare, people that come through the doors here at the hospital and our clinics, some of them are very healthy folks, but if we definitely have some of the more unhealthy, or I should say vulnerable people in our communities that we serve that are coming in and out of our doors. And so to mask for them for the time being, at least, I think is a very reasonable thing. So that would be asked of everyone as they come in and out of our facility. That will continue even after February 28th. I wanted to share a little bit also, because of how things are improving with the pandemic, that we're also making some changes in terms of our visitation policy here at the hospital. So on the clinic side, we're still going to do the screening on both places, the screening questions and everything like that. But on the clinic side, we are not going to have limits on the number of visitors that can come in with the patient to be seen by the individual practitioners. And on the inpatient, the hospital side, for inpatient procedures, inpatient stays, and even outpatient procedures, we are going to allow 1 or 2 visitors. It depends on where you're having either the procedure done or where you're as an inpatient, because certain places have more ability to accommodate visitors than others. But we definitely we're going to loosen that up a little bit to allow more folks to be able to come in. And as always, we'll continue to have our front door screeners and greeters who will direct you and give you more information as you show up in terms of what the process is here at the hospital for visitors. So we're trying to do all we can to loosen those up, while at the same time acknowledging that this pandemic is still officially a pandemic and has not become an endemic yet, although we're hoping that will be the case soon. Also at the hospital, for those of you who have been hospitalized recently in the past 2 weeks or so, or have come to visit folks who have been hospitalized, you know that we've had some issues with some of our rapid tests and having enough of those to test everyone who gets admitted to the hospital, so that we know whether they're positive or negative, and therefore we can put them in a non-isolation room or an isolation room based upon that. At the moment, we do have enough of those tests that we're able to test everybody who's being admitted, so that's going to be nice. We had a period of time where we had some patients who we had to assume their positive until we got the negative send out result that we had to send off. So that's encouraging for everyone, patients and staff alike. So some outside of our area, outside of our hospital news. I mean, I know that things are winding down, at least for this variant, and we hope for the best. I will say, though, that the latest data is that still 50% of the people who would be eligible for a booster shot have not received one. So if you're someone in that category, I still would encourage folks to do that. Also, from the CDC, Omicron makes up 100% of the new cases in our country right now. And it's interesting that the variants within Omicron, the initial Omicron BA.1 variant is 73.2%. And this other variant that you've heard about, the BA.2, is actually 3.9%, which doesn't equal 100%. So my presumption is there are some other subvariants that are making the rounds as well, which is to be expected with this virus, that there'll be, as more replication, there'll be more variants. In the New York Times weekly, they keep doing a running update on the number of patients, or number of people who test positive. It is at 76,000 roughly today, which is down 66% from last week, which is way down from weeks prior. And understandably, that doesn't include everyone who has COVID within that 76,000, because of people who just don't get tested or do home tests. But that's an encouraging number, and I think that's worth being happy about and being hopeful about. As always, the question becomes a equation about what variants will continue to arise, and how infectious will they be, and how sick will they make people. And that is a question that we still will to be determined, as well as, the combination of that and how many folks have been vaccinated, which helps to reduce spread too, and people who have had natural immunity because they've now had the infection. So that's kind of where we're at in terms of the pandemic right now. Encouraging stuff. Every week that goes by that I'm able to sit here and say numbers are looking better, the trends are good, is a great week. And I hope that we'll have another great week next week. Sure hope so. That's the way we're trending. I did want to talk about future plans for this broadcast. So we are tentatively planning on continuing to have weekly broadcasts. Obviously, as we continue to have a pandemic, we'll give updates on that pandemic. However, we also are going to transition back into having some educational and informational broadcasts where we bring on medical staff, physicians, nurse practitioners, physician's assistants, and even folks who work and manage various departments in the hospital to talk about things that are happening at the hospital, that services that those of you who watch may be interested in, and may be helpful in terms of knowing what's available through CGH. So we're going to start doing some of that in the upcoming weeks here, and we'll see how that goes and give that a try and go from there. So, Matt, I want to make sure we don't have any questions today. Going once, going twice, no questions. Good. All right. Well, hey, thank you for watching and tuning in. I hope everyone has a great week, and I'll be back next week. We'll plan being back next week with a guest to talk about something going on here in the hospital, and giving you an update on pandemic related news as well. Until then, goodbye.